Ma'am, it's live stream, ma'am. Shall we start, ma'am?
ఒక్క నిమిషం సందీప్ గారు, ఒక్క నిమిషం.
Now it's fine, no?
Full screen పెట్టి. Yeah, now it's fine.
Okay, done.
You can start, ma'am.
Hi everybody, welcome back to this class. We'll be discussing about deliriant poisons and the drug dependence and even abuse. Now, I'm your forensic medicine and toxicology educator, Dr. Prashi Kaveri, and today we'll be looking into this topic. Now, coming to what questions are discussed today, under long essays, we'll be discussing what is cannabis. We'll also be discussing about the various preparations, symptoms of acute poisoning, and the medical legal significance of cannabis. Coming to short essay, we'll be discussing about datura poisoning, the signs, symptoms, and even treatment, migraine symptoms, run amok, body package syndrome, drug addiction, drug dependence, drug tolerance, and also we're going to differentiate between drug addiction and drug habituation. Now coming to what Auricle has to offer to all the students, there are wide variety of recorded classes in which every subject is covered in detail. There are also live classes, practical sessions, exam module, and hard copy books that will also be provided to the students. Coming to the recorded classes, here it is going to offer a flexible learning experience where students can access all these lectures from the comfort of their home or wherever they are in. They can rewatch all these videos so that it is easy for them to revise also. Plus, all the educators here are going to give you a thorough knowledge about all the different subjects that is there. Coming to the live classes is going to offer you in-depth coverage of all the past 10-year PYQs so that you will be getting a fair insight as to what questions can come in the coming exams. Also, these are going to be interactive learning where there will be doubt clearance, MCQ polls, Viva OC, and many more so that the learning experience of students is enhanced. Coming to the express exam module, it is curated in such a way that every subject is completed in less than 20 hours so that it is going to be a platform where students can revise everything in a very short time. And when time constraint is a major thing just before giving an exam, this expert exam module is for your rescue. It is also going to teach you about all the answer writing skills, be it including diagrams in your paper, flow charts, or just the effective exam writing skill. The mentors are going to train you in all these aspects. There will also be one-to-one doubt clearing session where a student-centric approach is taken so that any doubt a student has, no matter how big or small, is taken care of. And personalized attention is given to each student. Here we aim to make your concepts very strong. And also this is going to be a safe learning environment where you can study without the fear of being judged. The hard copy notes that comes with Auricle gives you in-depth coverage of all the topic. It contains images, flowcharts, flashcards, and it is also going to help you gain that photographic memory so that you can do more well in your exams. And apart from this, we also have question bank, and in the question bank, we have 3 levels. It is curated in such a way that you go from beginner, and the last level is going to be the expert level. So these question banks are customizable according to the subjects, the chapters that you study, and it covers MCQs for all the prof exams, NEET, PG, as well as FMG. Now, coming to the practical session, it is going to give you hands-on experience about various clinical scenarios so that whenever you go and give your practical session, it becomes very easy for you. And also, it gives you a fair insight about Viva OC so that you are covered through and through. Now, coming to the various subscription plans that are there, there is foundation plan, advanced learning plan, complete learning plan, and also ultimate MBBS plan. Now, coming to the foundation plan, it has various things like the pre-recorded classes, live classes, express exam module, practical sessions, and even QBank. And coming to the last 2 plans, the complete learning plan as well as ultimate MBBS plan, here the extra things would be the hard copy note set and the one-to-one doubt clearing session. When you come to the ultimate MBBS plan, it is for 4 years. So you are going to be covered through and through throughout your MBBS. Now, before we start this topic per se about deliriant poisons and drug dependence and abuse, we have an MCQ poll for you. You can look into the MCQ, you can click on the answer that you feel is right, and we'll be discussing about it. So, coming to the first question is, which of the following is not typically associated with cannabis intoxication? So, you can select only one answer here and go through the question. You select whichever answer you feel is right. Here, the correct answer would be hyperactivity. It is because, as you all know, cannabis intoxication will usually sedate the person. It is a drug which is going to, make the person feel very chill. He's going to be very calm. And in this option, hyperactivity is something which is totally opposite to the sedativeness. Therefore, when they have asked not typically associated with cannabis intoxication, hyperactivity would be the correct answer. Whereas tachycardia, impaired coordination, and dry mouth are the anticholinergic features which will be seen in a case of cannabis intoxication. Now, coming to the second question. Which of the following is the most common source of atropine poisoning? So, in the options, you have datura, you have digitalis, oleander, and arsenic. The other name of datura is nothing but ginseng weed. Now, they are asking you which is the most common source of atropine poisoning. As we all know, datura is nothing but the most commonly seen roadside poison, and a lot of people tend to get poisoned from datura. And the major components that are there in datura are nothing but atropine and hyoscine. So the answer here would be datura, and it would cause all the symptoms like dryness, flushing of skin, and dilated pupils. Coming to the third question, all of the following are features of deliriant poison except. This is also a single choice answer, and the options given are hallucination, mydriasis, bradycardia, dry, and flush. Here, the answer would be bradycardia, because they are asking the question, they are asking you what are the features of deliriant poisoning. So, what do deliriant poisoning do? They are mostly anticholinergic. So, in the options, see, mydriasis is right, it is anticholinergic. So, dry flush skin is also right, and hallucination is also right. Whereas all these bradycardia is wrong because in the deliriant poisoning, like that of atropine, tachycardia is seen where there is increased heart rate in the person. Coming to the next question, which of the following is least likely a clinical feature of datura poisoning? It is also a single answer. There are four options: hallucination, tachycardia, sweating, and delirium. They're asking you which is the least likely clinical feature seen in datura poisoning. So, as we all know, whenever there is datura poisoning, it is anticholinergic. So, the skin would be dry, it is going to be flushed, the pupils are going to be dilated. So, basically, all the secretion from body is going to be less. So, sweating, which is an opposite, it's a cholinergic feature, right? So, that would be the answer here because they have asked least likely. Coming to the next question, a 24-year-old man is brought to the emergency department after being found confused and hallucinating at a music festival. He has dry, flushed skin, dilated pupils, and a heart rate of 140 beats per minute. His friends report that he consumes seeds from a plant, which is the following plant is most likely responsible for his symptoms. Here, if you see the features that are given, there is dry skin, there is flushed skin, dilated pupils, and a heart rate of 140. So all these typically are the anticholinergic features which are mentioned. And among the given options, that anticholinergic would be nothing but datura. The active principles here are atropine and hyoscine, which cause all these anticholinergic features. Coming to the last question, a 40-year-old female presents to the emergency room with nausea, vomiting, abdominal pain, and confusion. She has a history of alcohol abuse and is jaundiced. Her blood tests show elevated liver enzymes and her AST ratio is 2:1. What is the most likely diagnosis? So, in the question, if you come to all the cleansers, so the person comes with nausea, vomiting, abdominal pain, and confusion. And also, she has a history of alcohol abuse, probably a chronic alcoholic maybe, and is jaundiced. When an alcoholic patient comes with jaundice, that means he's consumed alcohol over a very long time. So, it is mentioning that the patient is a chronic alcoholic. And there is elevated liver enzymes, AST ratio is also 2:1. So all these point towards alcoholic hepatitis. Why not others? If it was cirrhosis, that would be the end-stage liver disease. There would be so many other features given. If it was acute hepatitis, fever would also be mentioned and the symptoms would be different. And here, because in the question, the cleanser of alcohol abuse is given, the answer would be alcohol hepatitis. Now, coming back to the topic of deliriant poison and drug dependence, we'll be discussing about the long answer. What is cannabis? What are the preparations, symptoms of acute poisoning, and the medical legal significance? So, what is cannabis? Cannabis is also called by various other names, like for example, it is called as hemp, hashish, marijuana, pop, dope, and grass. Now, coming to the what is the principal component, it is called as cannabinol. So, this cannabinol it gets converted to something called as THC. So, THC is nothing but tetrahydrocannabinol when it is exposed to heat. And this THC is a CNS stimulant. Therefore, most of the CNS features will be seen. Now, coming to what are the common preparations, the preparations are bhang, majoon, ganja. So, bhang is nothing but it is a preparation which contains 15% of the active principle. That is, it has 15% of tetrahydrocannabinol. And majoon is nothing but a sweet dish that is prepared with cannabis. And ganja is prepared from the female flower tops. And it contains about 50 to 25% of the active principle. And this ganja is also called as marijuana. Coming to charas and hashish, 25 to 40% of the active principle, that is THC, is found in charas as well as hashish. Now, coming to the signs and symptoms. These signs and symptoms are seen very soon, and it is going after the person smokes up, and it is going to last for 1 to 2 hours. And most of these signs are going to be psychiatric. That is, it is all going to affect his CNS. So he has a feeling of detachment, cleverness, there's disinhibition. Also, there's going to be euphoria, elation, dreaminess. So a person feels like he is out of reality, he is out of the world. Okay, and after this, there is also irregularity in the thought process. He gets irrelevant thoughts and he presents with decreased concentration. That is, he is not able to concentrate on anything. And coming to the sensory disturbances, he sees vivid images, illusions, and hallucinations. Apart from this, there is also tightness in the chest. Whenever there is tightness in the chest, the person feels like he might collapse and die. And also, there is impaired judgment. Now, coming to what are the other physical signs, there is increased appetite and thirst. So, these persons are going to completely hog on whatever food they find. Also, there is slight nausea seen in these people. He feels like a pressure effect on his head. Also, there is restlessness, ataxia, tremors, dry mouth, and tachycardia. Coming to what is the treatment for a case of cannabis poisoning. So, as I told you, for any of the poisoning, initially we always try to do a stomach wash because that prevents the further absorption of cannabis into the body. We can also give activated charcoal. So when you give activated charcoal, it absorbs whatever remaining poison is there in the stomach and the intestine. Therefore, further absorption into the bloodstream is hampered. You can give 100 ml of 50% glucose, 2 mg naloxone, and 100 mg thiamine IV. So whenever there is a case of any poisoning, be it alcohol poisoning or a poisoning like marijuana or cannabis per se, you always try to give glucose because the person looks very dehydrated. He is with lack of energy. That's why you give glucose, and also the naloxone because it's an antidote, as well as thiamine because thiamine is used in the metabolism of all these drugs. So the scarcity of thiamine, that's why you even supplement with 100 mg of thiamine. 5 to 10 mg diazepam if the patient is aggressive because of his calming property. Also, you can give other anti-anxiety medication, and if necessary, you can also give psychotherapy because if he is a chronic addict to any of these drugs, then you can obviously give him psychotherapy so that he can leave those drugs. Coming to the medical legal significance, there is issue of legalization and regulation. That is, many jurisdictions have legalized cannabis for medical and recreational use. But in India, it is still illegal, but so many other countries have legalized it. But for medicinal purposes, it has a lot of medicinal value. So that is what made so many countries legalize it for like chronic pain management, especially in those of cancer patients. Medical use and patient rights. The use of cannabis for medical purposes often raises questions about patient rights and physician responsibility. Because once it is there in the market for like pain management, people say that you can use it. People may not be very aware of how much can we take. So, on the long run, there can be over abuse. That is why there are legal issues pertaining to cannabis. Medical legal implications may include malpractice suits if a physician prescribes cannabis inappropriately or fails to warn patients about its potential risk. So, whenever a doctor is prescribing cannabis, you should also warn the patient about what would happen if a person overconsumes cannabis. Coming to what are the implications at workplace and employment in jobs requiring safety and sensitive tasks, like, for example, operating a heavy machinery, legal concerns about workplace impairment and a need for drug testing becomes important medical legal issues. Because, as I told you, after consuming dose of cannabis, the person's impairment becomes judged. He cannot concentrate, he cannot focus. So, if he is involved in operating a heavy machinery, it would become difficult for him to do so. Driving under the influence of cannabis is significant uh, legal issue, and many jurisdictions have established blood tetrahydrocannabinol concentration limits similar to blood alcohol level. So you know that the blood alcohol level should be less than 30 milligram per deciliter of blood. This is the safe driving limit of alcohol. In the similar way, in so many countries, THC concentration is also measured in blood, and that's why people consuming cannabis and driving could get caught. Coming to the public health and safety, medical legal considerations extend to public health policies on cannabis, such as its potential risk for minors, pregnant women, and individuals with mental health conditions. Because any drug in a person who already has a mental issue could precipitate it even more, or in these people, tolerance could develop even faster. So, there are such implications also when it comes to drugs like cannabis. Now, coming to the short answer, the first question would be datura poisoning. What are the signs and symptoms and treatment of datura poisoning? Now, in the picture, you can see that there are two types of datura mainly. The first one is white colored and the second is purple colored. And if you see the images closely, you can, you have seen these images in your garden or near your schools or in any open ground, because datura is one of the most commonly abused drug for poisoning. It is also a railway poison. It is found everywhere in India. And it is so colorful, right? So the small children, if they see this flower, they might tend to pick it up and put in their mouth. So these are the reasons for accidental poisoning with datura. Now coming to the active principles, all the parts of the plant are poisonous, be it nectar, seeds, or fruit. Everything is poisonous. And coming to the active principles, the compounds are hyoscine, hyoscyanin, and atropine. So when the major components are these, it will cause all the anticholinergic side effects. Now coming to what is the action of datura in the body. First, datura is going to stimulate all the higher centers, and finally it causes depression and paralysis. So initially, the person feels that high, he feels like he is flying, or also all these positive symptoms are seen. But later he goes into depression and paralysis. Now coming to the other signs and symptoms seen in the body, when the person comes in contact with leaves and flowers, like in huge doses, it would cause dermatitis. Also, when he puts the flower or leaf into the mouth, there is bitter taste. Also, there is dryness of mouth and throat, because as I said, it is anticholinergic. So any anticholinergic, the symptom would be dryness. Coming to the other signs and symptoms, there's difficulty in talking and swallowing, because his entire throat is going to be very dry. That's why the problem. Also, there is burning pain in stomach and vomiting, hoarse voice, face is going to look flushed, and the conjunctiva is congested. Remember what are the typical features of anticholinergic poisoning, and the same applies here also. The light reflex is going to be absent. There is also going to be photophobia and diplopia. That is, whenever the person tries to look at something, he sees two images of the object. Whenever the person ingests the pollen, there can be unilateral mydriasis seen. That is, only one eye, the pupil is going to be dilated, and such a pupil is called as conspicuous pupil. Remember this term. It is quite important to mention this term whenever it is asked in your exam. Also, the other anticholinergic features would be urinary retention, and the skin is going to be dry and hot. The muscle tone is increased and there is also muscular spasm. A person tries to pull imaginary threads. There is pill rolling movements. That is in his hand between the index and thumb. He continuously does this movement. So this is called as pill rolling movement, and he threads imaginary threads. So basically, he's going to have a lot of visual hallucinations. Now, coming to what are the treatment, firstly, you can give emetics. You can also give stomach wash. So whenever you give emetics, it's going to puke off all the remaining things from the stomach. When you give stomach wash, it is with potassium permanganate. It is going to prevent the further absorption of the poison into the body. Activated charcoal on its surface, it absorbs all the remaining poison from the stomach. So it prevents the further absorption of the poison into the bloodstream. Also, you can give physostigmine 1 mg because it is going to counteract with all the symptoms of atropine poisoning, and you can also try giving pilocarpine. What are the post-mortem appearances that is not characteristic? Asphyxia is seen. Remember, in most of the poisoning, with let it be corrosives or let it be something which is a plant poison, asphyxia would be a major sign that is seen. Magnan symptoms. What is Magnan syndrome? Magnan syndrome is nothing but a very rare psychiatric disorder which is characterized by the person seeing hallucinations and delusions often linked to substance abuse, particularly cannabis. So remember, cannabis intake is one of the major causes of Magnan symptoms, and these are mainly seen only in intake of cannabis. So these are the various delusions and the hallucinations the person experiences on chronic intake of cannabis. Coming to the key features of Magnan syndrome, they are nothing but cannabis-induced psychosis. These are the psychotic symptoms that are seen in these people, and these psychotic symptoms resemble the symptoms that are seen in schizophrenia. There are also hallucinations and delusions. That is, the individual may experience vivid auditory and visual hallucinations. That is, he sees flashes of lights, or he might feel like he's traveling in space. So these are all the visual hallucinations. And coming to auditory hallucinations, he might have first person, second person, or third person hallucination, where he feels like somebody, like an alien, is talking to him, or two people are talking to each other, and this person feels like he's able to hear them. There are also personality changes. That is, a long-term use of cannabis can lead to lasting changes in personality in susceptible people. Also, in individuals with Magnan syndrome, there might be emotional disturbances, including mood swings and depression. That is, their emotional status is not static, or it can vary from time and again. There is also going to be cognitive impairment. That is, there might be cognitive difficulties. You might have a problem in remembering, even the tiniest details. There could be deficit in the recalling. There's going to be impaired memory, and the attention span of these people is also going to be reduced. Now, coming to what is the management. Now, coming to the management, firstly, we have to discontinue the cannabis and other substances that could potentially cause Magnan syndrome. You have to advise the person to take up psychotherapy, because whenever he goes to psychotherapy, it is going to address all the underlying mental issues. Also, you can start him on antipsychotic medications, and you have to start on antipsychotic medications only if the symptoms are very severe. Initially, you can start with psychotherapy, and if the patient is not adherent, or if the symptoms aren't coming to normal, only then you start with antipsychotics, because antipsychotics have their own set of side effects, which might, cause a drastic change in the life of the person, and he might feel like his life is becoming even worse. Now, coming to the third question, it is about run amok. So, what is run amok? It is also seen in chronic poisoning of cannabis. So, run amok means the tolerance that develops with the chronic intake of cannabis. So, there is a psychic disturbance marked by a period of depression followed by violent attempts to kill people. This nature is called as run amok. He kills a person against whom he may have real or imaginary enmity, and then later he might start killing anybody that would come in his way. And he's not willfully doing it. He has lost control over his capacity to think. That's why there is this action in chronic cannabis poisoning. Finally, after he tries to kill somebody or anybody that come in his way, he might commit suicide by himself. So basically, he's very amotivational. He doesn't want to do anything, and later he becomes that depressed where he commits suicide by himself. There is something called as body packer syndrome. So what is body packer syndrome? It is the act of swallowing containers, condoms, balloons, or plastic bags, which is filled with illegal drugs for the purpose of smuggling. So, whenever a person has to smuggle these certain drugs of illicit use from one country to another, there are so many movies. So recently, this is Kareena Kapoor's movie where in the chocolates they try to smuggle drugs. So similarly, here the person tries to swallow all these, and he is going to take it. One packet of these drugs, which is stored in either these balloons or plastic bags, would contain around 3 to 7 grams of the drug. And after he swallows this, he's also going to take one loperamide tablet. So what does loperamide tablet do? It is going to reduce gut motility. So the purpose here is after he swallows, he doesn't want to go to the washroom and get rid of it from his body. That's why he is going to take in loperamide so that the gut motility is reduced. And whenever he's there in the long distance flight, all these drugs stays in place. And on arrival, after he reaches his destination, he takes a laxative and then he is going to evacuate a bowel, and in the poop he is going to clean it and recover the packet. So this is basically the essence of body packer syndrome. There is also something called as body stuffer syndrome. So what is body stuffer syndrome? Here a person arrested swallows illegal drugs to conceal the evidence from authorities. So here the initial thing that you have to remember is nothing but the person is already arrested. He is in custody. Now he takes certain drugs so that his mental consciousness is altered and he doesn't have to tell the actual truth in front of the authorities. And here he can stuff the drug. It's called stuffer because he stuffed the drug in any of the openings. Like for example, your mouth, nose, vagina, or rectum. In any of these openings, he is going to stuff certain illicit drugs so that he doesn't have to tell truth in front of the questioning authority. Here you can identify this by using X-ray or CT. And whenever you take this person to X-ray or CT, all this stuffed drugs will be visible and hence you can get caught. Now, coming to drug addiction and drug dependence. What is drug addiction? So, drug addiction is a state of periodic or chronic intoxication produced by repeated compulsive consumption of drug, resulting in physical, psychological, and social harm and harmful to the individual or society. So, drug addiction occurs when the person continuously takes drug, and without taking this drug, he cannot lead a normal life. He repetitively consume drug and it kind of becomes a compulsive habit. And he feels like taking these drugs would be important than any of the other more important day-to-day activities. And finally, he is going to have physical and psychological addiction, and he is going to harm himself and the society. Even though there is an important event happening in his home, like for example, he knows that he has to go and fill the child's fees in the school. He might feel like using that money to procure these drugs would be more important than going and giving the fees. This is what would actually happen in people who are addicted to drugs. And the drugs of addiction are some of the examples include alcohol, opium, LSD, and amphetamine. So there are various names for all these, like meth. It is also called as speedballs, and so many other names also. So these are the most commonly addicted drugs. Apart from these, even coffee and tea. There is caffeine and nicotine addiction also, but these are the safer ones. Now coming to what is drug dependence. So drug dependence is nothing but a combination of addiction and habituation. For drug dependence, psychological dependence is a must and not physical dependence. That is his mental tolerance, like the capacity, all his judgment and various things that he does mentally are all impaired if he doesn't take in the drugs. So mentally, he is completely dependent on the drug. That is what is meant by a psychological dependence for a drug. Physical dependence means he taking in the drug to the body physically. So this physical dependence is a biological phenomena. It depends on the type, dose, and duration, and it is different for each of the different drugs. If the drug is withdrawn, withdrawal symptoms are seen. Therefore, whenever a person goes to any of the psychotherapy or rehab, they always try to cut down the dose of drug gradually, and also they are going to give all the proper antidotes, antagonists, so that all the symptoms aren't this withdrawal symptoms do not occur. Now coming to little in depth about what is psychological dependence. It is a compulsive need for a drug in order to maintain the state of well-being occurs in absence of physical dependence. So this physical dependence and psychological dependence need not go hand to hand. A person might be psychologically dependent on the drug and not physically, or he might be physically dependent on the drug and not psychologically. And as I told you, if it mentions psychological dependence, that is all his mental capacity, his well-being are all dependent on the drug, and he feels like he is mentally okay only when he gets the drug. That is the meaning of psychological dependence. And sometimes even after he physically takes the dose, even then he feels like it is not enough to reach that psychological state where he has to feel okay. Now, what are the symptoms of drug dependency? They are loss of appetite and weight. The person is going to have clumsy movements, unsteady gait, and tremors. So you might see some people who are chronically into taking drugs. They might look very lean and devastated. It is because of loss of appetite, and there are going to be clumsy movements, unsteady gait. When the person walks, he doesn't walk like a normal person. He's going to be swing towards one of his side and walk. And also, they're going to be fine tremors. Earlier in the question, I told you about the pill rolling tremors. No, it could be the pill rolling tremor where there is a movement between the index and the thumb finger, or it could be very mild shakes that are seen in his hands. The other symptoms would be puffiness of eyes, slurred speech, loss of interest, lethargy, depression, mood changes, emotional detachment, and impaired memory and concentration. Coming to slurred speech, whatever he is trying to speak, it is not going to be normal. Like, for example, whenever you take a Broca's aphasia, which is nothing but the motor aphasia, whatever happens there, the same thing is seen in these people. There's also a loss of interest in every activity that he had interest before. So it is commonly called as anhedonia. That is loss of interest in all the previously pleasurable interests. So, for example, if a person like to go out and play or go out and meet his friends, is going to lose all the interest, is going to remain by himself. The person is lethargy, that is, he doesn't want to do anything, he's depressed, there are mood changes also, and on chronic intake, there is tolerance developing, that is, with the same doses that he used to take initially, he is not able to reach that height. So to reach that height, he's going to consume more and more doses of drugs. This emotional detachment, that is, as I told you, if there is a very important event happening in the family, he prioritizes him taking the drug over that event. This impaired memory and concentration, the immediate memory is also, he's not able to recall the immediate things also. Now coming to drug tolerance. Drug tolerance refers to the phenomena where a person's body becomes less responsive to a drug after repeated use. As I told you before, he's not able to get the same high with the same initial doses he started with. Therefore, to get the same effect, he's going to increase the dose. So initially, if his dose was around 0.5 mg, later to get this, and imagine he reached this effect, later he is going to need more doses to reach the same effect. This process is called as drug tolerance. Now coming to the different types of drug tolerance, number one would be pharmacodynamic tolerance. That is, the body's receptors become less responsive to the drug. Because these receptors do not react in the normal way how it reacted earlier, the person has to take a larger amount of doses. Also, there is something called as pharmacokinetic tolerance. Here, the body's metabolizing capacity of the drug increases. So, when the body metabolizes the drug very fast, the actual drug isn't there in the body, and the effectiveness of the drug is reduced. That's why the person tries to consume more and more drugs. Also, there is something called as behavioral tolerance. That is, the person learns to compensate for the drug's effects, making them appear less impaired. Also, there is something called as cross tolerance. So, what is cross tolerance? Tolerance to one drug can lead to reduced sensitivity to another drug in the same class. For example, tolerance to alcohol may reduce the sensitivity to other depressants like benzodiazepines. This is called cross tolerance because whenever a person takes, for example, if you take the case of alcohol and benzodiazepines, whenever a person is constantly drinking, he might also develop tolerance to benzodiazepines. That is, if he takes benzodiazepine sometime else in his life, he'll have to require longer doses, even though that was not his principal drug that he started with. Coming to increased dosage, as tolerance develops, individuals may require progressively larger doses to experience the same effect. This is what I explained with the image here. So, if this is the effect, to reach this same effect, he is going to take increased amount doses of drug. There is also physical and psychological tolerance. That is, tolerance can affect both physical. So, what is physical? Physical implies the body's ability to handle a drug, and psychological is the subjective experiences of the drug's effect. So, psychological are everything that has to do with the well-being of the person. That is, he feels like he's okay just because he's taking the drug. That sense is psychological, and physical is about the quantity. So, there is tolerance for both physical and psychological. Coming to the next question, here where we are going to differentiate between drug addiction and drug habituation. So coming to drug addiction, so in firstly we'll look at certain points. So we'll be discussing about compulsion, dose, dependence, withdrawal symptoms, and harm. On the basis of these points, we'll be differentiating between drug addiction and drug habituation. So coming to drug addiction, so compulsion is present in drug addiction. That is, he will constantly feel like taking the drug each and every day. There is a compulsive urge. Whereas in drug habituation, there is a desire that is a person might feel like taking drug, but there is no compulsion. That is, he's okay if he doesn't get the drug. Now coming to dose, in drug addiction, it tends to increase due to something called as tolerance, as we already discussed. There could be tolerance to various aspects like physical, psychological, and even cross tolerance. Whereas in drug habituation, there is no tendency to increase. So habituation is seen in those people who use drugs for recreational use. They want it, but then they're okay if they don't get it. That is the meaning. Now, coming to dependence, in drug addiction, there is psychological as well as physical dependence. That is, his well being as well as physical state, both are dependent on the drug. Whereas coming to drug habituation, there could be some degree of psychological tolerance, but not physical. That is, he might feel like if he takes that drug, he might get high and feel good. Coming to the withdrawal symptoms in drug addiction, it is going to be very characteristic. Like, for example, the person might present with nausea, vomiting, chest tightness. He feels like that impending doom where he might collapse and die. There are all these symptoms that are seen when a person stops consuming a drug abruptly. Whereas in drug habituation, because this is very recreational and there is no compulsion, even the withdrawal symptoms are none or usually very mild. Now, coming to the harm in drug addiction, both to the there is harm to the individual and to the society. Whereas, because as I told you, he might prioritize him taking a drug over his friends or family. That is why the society is affected. Whereas in drug habituation, only the individual is affected because it's not a long-term thing and there is no compulsion. So he may not go and damage anything outside. Now, briefly, if you see all the questions that we discussed today, remember when it comes to cannabis poisoning, because it was a 10 marker, firstly, you need to write about what are the active principles. Then you need to explain about the common preparations that are there. So, common preparations, bhang, majroon, ganja, charas. Later, you have to talk about what are the signs and symptoms. So, mainly they are the psychiatric symptoms, that is everything related to the CNS, There is sensory hallucinations, there is impaired judgment and impaired thought process. And coming to physical, there is nausea, restlessness, all those come under physical. And coming to treatment, stomach wash, activated charcoal, 50% glucose, naloxone, and thiamine. So this is going to be a brief. So if you highlight these many points, it will be easier for you to revise at the end. And the medical legal significance, you can write about its use in medical and recreational use, and what happens when a person consumes it and drives, and what happens when a person who is implied in working with operating heavy machinery takes in these drugs. Coming to datura poisoning, you have to always mention about the active principle. Here it's hyoscine, hyoscyanin, and atropine. And what is the action, signs, and symptoms? All the anticholinergic features like flushed skin, dryness of skin, pupils are dilated, tachycardia, these are going to be mainly seen. And all the reflexes are going to be absent. There is going to be a photophobia, and there's urinary retention, and there are fine movements like pill rolling tremors that I showed you earlier. And treatment is done with emetic, stomach wash, activated charcoal, and physostigmine. Coming to postmortem appearances, asphyxia is mainly seen. Marfan syndrome, it is the hallucination and delusion seen with cannabis use. And the features are similar to schizophrenia, where the person sees vivid auditory as well as visual hallucination. There is also personality change. He might have mood swings and depression, and the attention span also comes down. Coming to management, antipsychotics can be tried for the serious cases, and psychotherapy is the mainstay of treatment, and the person should be advised to leave consuming these drugs. Run amok, it is that attempt the person makes to kill somebody. He is going to be very depressed. Later, initially he might kill somebody with whom he had a grudge, later kill anybody that came on his way, and finally he might commit suicide and die by himself. Body packer syndrome, it is used for smuggling. Packets of drugs are taken into the body. Loperamide is taken to reduce gut mobility, and after reaching the place, he takes a laxative and excretes these drugs outside. Body stuffer, in arrested people, they take these drugs in order to conceal telling the truth. Drug addiction, it is that compulsive consumption of drug, and it feels like drug is important than anything, and drug addiction leads to tolerance later. Drug dependence, there is both physical dependence and psychological dependence. Psychological dependence is when he feels like all this emotional and mental well-being was because of the drug. And physical dependence per se means physically being dependent on the drug. That is, he wants that drug to feel high. Symptoms of drug dependence, clumsy movement, unsteady gait, and there is also loss of weight and appetite. He loses interest in everything that he liked before, that is anhedonia. He's going to be depressed, there are going to be mood changes, and impaired memory and concentration. Coming to tolerance, tolerances require higher doses of a drug to get the same high. And there are different types of tolerance like pharmacodynamic, pharmacokinetic. So these are for the various actions of the drug on the body. There is cross tolerance, that is one drug, for example, alcohol brings in tolerance to one more drug like benzodiazepine. So the person increases taking the dose to get the same high. Now coming to difference between drug addiction and drug habituation. In drug addiction, the person has this compulsion to the drug, so he takes more and more amount of the drug to feel the same high. Whereas in drug habituation, he just needs the drug, he has the desire for all the psychological aspect of the drug, but he's okay if he doesn't take the drug. And here it is going to affect only the individual and not the society. Whereas in drug addiction, the individual as well as people around him, his friends and family are also affected. So that is the end of the class today. I hope you enjoyed the class and also all the MCQs that we discussed initially. Now, thanks for watching. I hope this class was useful. And you can subscribe to Auricle to watch all these interesting videos, the live classes. And also, it will also help you in writing your exam. You're going to get a fair insight as to how you need to approach each question and what are the important things that need to be there in the answer for you to score all those extra marks. That's all. Thank you.